Podophyllum is another really useful GIT medicine, especially lower gastrointestinal tract. We chiefly think of it as a diarrhea kind of a medicine. This is Podophyllum peltatum. It's quite a pretty little plant. It's also known as the May apple or American mandrake. This is not the mandrake of Harry Potter kind of fame. That we also use that in homeopathy. It's called mandragora. So this is uses the word mandrake, but it's a different plant than what you may think of. It's Berberidacea, which is again we get a lot of spices and herbs come from this family. It belongs to the Ranunculales order, and in homeopathy we make the tincture from the root of this plant and then prepare it up from the tincture of the root. It's been a bit used herbally. It's been used as a purgative or a laxative, so it induces diarrhea, induces bowel emptying it's acute primary action, so we use it against those symptoms homeopathically. It's also been used topically to treat warts. It's been used for tumours, including in the testicles and lymphomas in some herbal approaches. If we look at the pharmacology, so its toxins inhibit the growth of cells by acting as mitotic spindle poisons. So it's quite toxic, and the side effect of that is cells don't start to grow, start to develop. That's part of the reason why it's been investigated as a cancer, anti-cancer medicine. It also causes necrosis of tissue when applied to external carcinoma and warts less than 4 cubic centimeters. So it's put on topically because of that mitotic damage that it does to cells. It's been used to kill off warts and growths and tumours and skin lesions and all kind of topical stuff. Ingestion of the substance leads to irritation of the eyes, the mucous membranes, gastroenteritis with colic, vomiting, long-lasting bloody diarrhea, cough, tachycardia, delirium, coma, and death from respiratory arrest. So it depends on the size of the dose that you get. You can have quite serious negative effects. The most common thing from smaller doses is going to be gastric upset, colic, which means spasms of the intestines, painful spasms of the intestines, vomiting, diarrhea, particularly bloody kind of diarrhea is the sort of stuff that can get caused. If we look at the trial, so Williamson, 1846, used a 1x, 3x, and 15x on 6 males. Ian P. Friedrich with a Q30 on 9 female and 4 males in the late 90s. And there's a lot of poisonings and clinical confirmation symptoms. And a lot of you can imagine with a substance that's toxic like this, a lot of the symptoms come via poisoning and toxicology. A quote here from Grant George. Grant George says, "It's a good remedy for children with diarrhea, especially during teething." So diarrhea is a common symptom that occurs during teething. Lots of kids, when they start teething, get diarrhea. We may think of something like chamomilla. It's famous for having its teething. It's cranky. It's irritable. With that, chopped spinach and chopped eggs and spinach kind of diarrhea. We compare that also to something like podophyllum. It's really good at that situation. The stool of podophyllum is a little bit different. It's a liquid stool with a nauseating odor, so it can be even a sweetish, nauseating kind of odor, especially occurring in the morning, with a distended abdomen and colic, forcing the child to lie on her stomach. Sometimes there's rectal prolapse, so it's like a falling or a slipping downwards of the rectum, so it can even kind of hang out of the anus a little bit in extreme cases, which can occur during stools. Also in feverish cases, the child is quite talkative, and so he suggests giving the remedy in a 7C, 3 granules after each abnormal stool. During pregnancy, it's also a good remedy for rectal prolapses for hemorrhoids, so that kind of lower rectum issues is a strong indication for this medicine. If we look at materia medica, so big gastrointestinal complaints, but also female genitalia, so there's some female hormonal stuff there. We're going to focus more on the gastrointestinal stuff. And so if we jump straight down to abdomen section, a sensation of weakness, emptiness, or sinking. So things falling downwards, like a rectal prolapse, is also a sensation in this medicine. That sinking, falling kind of feeling. Rumbling before stool. This is a medicine for when there's a lot of kind of water and gas in the digestive system. There's a lot of borborygmi, rumbling noise. There's a lot of stuff going on in the lower abdomen in particular. The liver region can have liver issues, gall pains, etc. Abdomen pain. Interesting thing is better for flexing the thighs or bending forward, which might remind us of colocynthis had that better for bending forward. Podophyllum has that as well. The big symptoms you're going to think that's often for is based on diarrhea. So diarrhea, worst to 4 or 5 a.m. in the morning, early morning diarrhea. During teething, from hot weather, from acid fruits, from eating or drinking. Diarrhea that alternates with constipation. And the big characteristic thing is, think about all the liquid and the gas they've got in their digestive system. So they get this spluttering kind of diarrhea that's mixed with gas. So people are moving water in a spluttery, kind of stoppy-starty sort of a manner because of the large amount of gas, as well as the large amount of liquid in their large bowel. Explosive, profuse, Soils the whole toilet bowl, so it's kind of a wide angle spray. We're talking a large amount of liquid stuff going on here. Can also have involuntary stools, so not pleasant when you have this kind of stool going on, and the potential for prolapse kind of symptoms of the rectum. It's pretty obviously more in chronic situations rather than acute ones, but that's an observed symptom as well. Podophyllum is a really useful medicine if someone's got that kind of explosive, spluttery, watery, gassy kind of a stool, especially if it's got that nauseating kind of smell going on, and there's not a whole lot of other things. If there's other stuff that might lead you towards a different medicine, then you might think of a different medicine. Podophyllum, at least in my understanding of it, the way I've used it, is often a medicine I kind of fall back on if I go, well, there's nothing particularly characteristic going on, there's no great modalities or anything, but there's just like really lots of water, lots of gas, kind of fluttery, frothy kind of stools going on, then podophyllum would be the first medicine I would reach for.